This is about psychological warfare.
왜곡된
A specific type of warfare designed to distract,
무감각하게 만들어
misinform,
But trust me.
특정 형태
and anesthetize the brain.
We interrupt our programming. This is a national emergency. Important instructions will follow.
우리는 우리 마음에 파고드는
We must remain vigilant at all times
항상 경계의 고삐를
and be alert to their insidious attack on the mind,
이전에도 그러했듯이
for they have come before
이러한 공격은 또
and they will come again.
What's up everyone, peace, hope everyone's doing good. Today's video is going to be about bromine or bromide. As you can see in these pictures, it's in your soda or your soft drinks, it's in bread and a lot of other products, and it will be explained in these 3 different parts that I uploaded. So I hope you enjoy, learn something, and let me know in the comments what you think. Peace. What's good everyone, peace. This video is going to be about bromine, another chemical found in our foods that is poisonous, and I advise people to research. There's lots and lots of information, and if you look at the ingredients in your food and you start to research each so-called ingredient, you'll find that a lot of them are not natural and it causes health problems. So let's move on. Let's start with this PDF explaining bromine. Poisonous facts. Properties of the chemical. Bromine is a dark, reddish brown, volatile, diatomic liquid with a suffocating odor at room temperature. It is the only liquid, non-metallic element. Bromine is capable of dissolving metals and non-metals. Tremendous heat is produced when bromine reacts with inorganic matter such as wood or sawdust, increasing the risk of combustion following bromine spills. Because the vapor pressure is so high, the red vapors are immediately detectable when the container is opened. Bromine is slightly soluble in water, producing hydrogen bromide. Hydrogen bromide is a corrosive colorless gas with a pungent odor. It is extremely soluble in water, forming hydrobromic acid. Uses of the chemical. Bromine is used in the form of methyl bromide and ethylene dibromide as a fumigant. Bromine is also used in flame retardants, cleaning agents, dyestuffs, photography, water sanitation, and pharmaceuticals, as well as in the bleaching of fibers and silk. Absorption, distribution, metabolism, and excretion. The reactivity of bromine in biological systems makes it difficult to determine its pharmacokinetics. I probably said that very wrong. Pharmacokinetics. I think I said that pretty good. Pharmacokinetics. And to separate the effects of bromine from those of the bromine compounds and metabolites. The absorption of bromine vapors by routes other than inhalation is usually minimal. Due to its reactivity, bromine does not persist as an element in living tissue but quickly forms bromide. Clinical effects of acute exposure. Ocular exposures. Low concentrations of bromine vapor produce irritation of the eye with lacrimation, photophobia, and blepharospasm. Blepharospasm are seen in higher concentrations. Dermal exposures. Both the liquid and vapor forms are extremely irritating to the skin. There is no immediate visible skin reaction with contact. Any delay in treatment before the initial signs of injury become apparent often results in more extensive damage. The most common local effect are blister formation, a brownish discoloration of the skin, and slow healing ulcers. Inhalation exposures. Inhalation symptoms progress from coughing, choking, I don't know that word, dyspnea, I don't know, and wheezing to either immediate or delayed bronchoconstriction. Other symptoms include the development of laryngeal spasm, glottoedema, asthma, and tracheobronchitis, with increased parenchymal penetration. I'm saying these words pretty wrong, I think. It is likely that there will be peribronchiolar abscesses, pulmonary infiltrates consistent with chemical pneumonitis, bronchiolitis, and pulmonary edema. Severe respiratory symptoms may be delayed for several hours after exposure. Sorry everyone for not pronouncing these words. Some of them not pronouncing them pretty good, but let's move on. Indigestion exposures. Although ingestion is unlikely, a brownish discoloration of the tongue and buccal mucosa may occur and be accomplished by the characteristic bromine breath odor. In-field treatment prior to arrival at a healthcare facility. Ocular exposures. Irrigate the eyes with copious amounts of tepid water for at least 15 minutes. Dermal exposures. Remove contamination clothing and thoroughly wash the affected area with copious amounts of water for 20 minutes. Inhalation exposures. Remove the patient from the source of bromine contamination and supply oxygen if available. Ingestion exposures. Rinse out mouth with large amounts of water, small amounts of water, 240 milliliters for adults and 120 milliliters for children should be ingested to dilute the chemical. Special note to first responders. Wear a positive pressure self-contained breathing apparatus, an SCBA. Wear chemical protective clothing that is specifically recommended by the manufacturer. Treatment of exposures in a healthcare facility. Ocular exposures. Initiate or continue eye irrigation using 0.9% saline solution. If irritation, pain, swelling, lacrimation, or photophobia persist, further medical evaluation is recommended. Dermal exposures. Remove contaminated clothing and thoroughly wash the affected area in a shower of water for 20 minutes. Since the effects may be delayed, close observation for blistering and discoloration of the skin is required for the next 24 hours. Inhalation exposures. Begin respiratory support based on patient symptoms. Maintain an adequate airway. Oxygen and inhaled adrenergic agonist as needed. The delayed onset of severe respiratory symptoms justifies hospitalization for 24 hours. Initial chest x-rays and spirometry are recommended. Repeat chest radiograph and spirometry are recommended to determine the progression or resolution of residual effects. The course and prognosis of a bromine, I think it's bromine or bromine, one of the two, exposure depends on the concentration and duration of the exposure. Effects may vary from mild irritation and, I can't read today for some reason. Depends on the concentration and duration of the exposure. Effects may vary from mild irritation and the mucous membrane to severe damage of the skin and lung parenchyma. Death is secondary to severe hypoxemia with metabolic acidosis due to acute obstructive ventilatory impairment. Ingestion exposures. Irrigate the oral mucosa with copious amounts of water. Give the patient small amounts of water, 240 milliliters for adults and 120 milliliters for children. Look for brownish discoloration of the tongue and buccal mucosa. Observe the patient for blistering for 24 hours. And here's the poison control center, but that's for Kansas. So let's move on. I have some more information and stuff to share and what foods have or cause health risks. Good, everyone. Peace. So this is the next part, or whatever order I put it in. It's about bromine, the chemical properties of bromine, health effects of bromine, and environmental effects of bromine. The atomic number, the atomic mass, and all this you could look right here. So bromine, at ambient temperature, bromine is a brownish red liquid. It has a similar colored vapor with an offensive and suffocating odor. It is the only nonmetallic element that is liquid under ordinary conditions. It evaporates easily at standard temperature and pressures in a red vapor that has a strong, disagreeable odor resembling that of chlorine. Bromine is less active chemically than chlorine and fluorine, but is more active than iodine. Its compounds are similar to those of the other halogens. Bromine is soluble in organic solvents and in water. Applications. Bromine is used in industry to make organobromo compounds. A major one was dibromoethane. Dibromoethane, an agent for leaded gasoline, before they were largely phased out due to environmental considerations. Other organobromines are used as insecticides. and fire extinguishers, and to make pharmaceuticals. Bromine is used in making fumigants, dyes, flame-proofing agents, water purification compounds, sanitizers, medicinals, agents for photography, and in brominates vegetable oil used as emulsifier in many citrus flavored soft drinks. And I'm going to get into that in a little bit. Bromine in the environment. Bromine is a natural occurring element that can be found in many inorganic substances. Humans, however, have many years ago started the introduction of organic bromines in the environment. These are all compounds that are not natural and can cause serious harm to human health and the environment. In diffuse crustal rock, bromine naturally occurs as bromide salts. Bromine salts have accumulated in seawater, 85 parts per minute or meter, I don't know, from which bromine is extracted. World production of bromine is more than 300,000 tons per year. The three main producing countries are US, Israel, and the UK. In this last case, it is extracted from seawater at a plant on the coast of Angel, Wales. I probably said that wrong. Health effects of bromine. Bromine is corrosive to the human tissue in a liquid state, and it vapors, irritates eyes and throat. Bromine vapors are very toxic with inhalation. Humans can absorb organic bromines through the skin, with food, and during breathing. Organic bromines are widely used as sprays to kill insects and other unwanted pests. But they are not only poisonous to the animals that they are used against, but also to larger animals. In many cases, they are poisonous to humans too. The most important health effects that can be caused by bromine containing organic contaminants are malfunctioning of the nervous system and disturbances in genetic materials. But organic bromines can also cause damage to organs such as the liver, kidneys, lungs, and milt, and they can cause stomach and gastrointestinal malfunctioning. Some forms of organic bromine, such as ethylene bromine, can even cause cancer. Inorganic bromines are found in nature, but whereas they occur naturally, humans have added too much through the years. Through food and drinking water, humans absorb high doses of inorganic bromines. These bromines can damage the nervous system and the thyroid gland. Environmental effects of bromine. Excuse me. Organic bromines are often applied as disinfecting and protecting agents due to their damaging effects on microorganisms. When they are applied in greenhouses and on farmland, they can easily rinse off to surface water, which has very negative health effects on Daphnia, fishes, lobsters, and algae. Organic bromines are also damaging to mammals, especially when they accumulate in the bodies of their prey. The most important effects on animals are nerve damage, and next to that, DNA damage, which can also enhance the chances of development of cancer. The uptake of organic bromine takes place through food, through breathing, and through the skin. Organic bromines are not very biodegradable. When they are decomposed, inorganic bromines will consist. These can damage the nerve system when high doses are absorbed. It has occurred in the past that organic bromine ended up in the food of cattle. Thousands of cows and pigs had to be killed in order to prevent contagion to of humans. The cattle suffered from symptoms such as liver damage, loss of sight, and depletion of growth, decrease of immunity, decreasing milk production, and sterility and malformed children. Wow. So picture this cattle giving milk and it goes into the store or something. Like, it's crazy the way they just spray these chemicals everywhere. And it also stated that it's used on farmland. I mean, what are people thinking? And this is a website called Lentech, and you could find all sorts of different metals, as you see here. It goes down the whole list, I think. So we're gonna move on and show some of the products that bromine is in. Good. Now, since we're back, I found this on a website called Thyroid Nation, as you can see here, and I've been researching this bromine in sodas and food and stuff. And this is a pretty long website, but we're gonna get as much information as we can out of here. But I still advise people to do their own research. You know, there's stuff that I could miss. Nobody's perfect, and that's why I always say do your own research. Look at things from every angle. Look at people that agree with it and don't agree with it, because in my eyes and from my experience and learning, you could always get something out of whether the person agrees or don't. And that's through trial and error in life. I've learned this. So even if, like I said, if I don't agree, I even find something I could learn. There's always something to learn out of everything. So let's move on. Bromine in soda drinks adversely affects your thyroid gland, and we just read that in the article that I shared. Bromine is in many things, including soda. Dr. Maxwell discusses the many negative effects it has on your health and your thyroid. There's a sneaky additive in your soda that can cause you to develop thyroid disease. You may have heard how unhealthy high fructose corn syrup and aspartame, I'm probably saying that wrong, can be, but you may have never heard of a sneaky additive called brominated vegetable oil. Oh, I thought it was in vegetable oil and soda, but it's the syrup that they put in the soda. Okay. If you enjoy citrus flavored sodas like Mountain Dew and Sundrop, you could be putting your health at risk, it states. What's so dangerous about brominated vegetable oil? Bromides are, what does that say? Endocrine or endocrine? I think it's endocrine disruptors. Bromides are endocrine disruptors that have a negative impact on the way hormones work in your body. Brominated vegetable oil is a halide, a binary compound that competes for the same receptors used by your thyroid gland to capture iodine. If your exposure to BVO and other sources of bromine are excessive, it could cause all the iodine in your body to be eliminated and replaced by bromine. Wow. This can lead to a harmful iodine deficiency resulting in hypothyroidism. If your thyroid is not functioning the way it should be, it can cause a cascade of symptoms that can sometimes be difficult to pin down. Symptoms of hypothyroidism include fatigue, cold sensitivity, facial puffiness, constipation, difficulty losing weight, brittle nails, dry hair, and leg swelling. The most common cause of hypothyroidism is Hashimoto's thyroiditis. Why they gotta name these things all difficult? Additional health risk of bromine and bromides. In addition to wreaking havoc with your thyroid, bromides have also been shown to increase risk of stomach cancer. A recent agriculture health study showed that excessive exposure to bromide can cause a significant increase in the development of stomach cancer. Man. And I also heard that soda rots your guts, so that kind of makes sense. Fibrocystic breast disease. If you have been diagnosed with fibrocystic breast disease, it could be caused by low iodine levels in your blood. Studies have revealed that iodine therapy has been able to treat fibrocystic breast disease naturally. Mental health problems. One of the more alarming side effects of bromine is a condition called bromine intoxication or brominism. It has been shown to cause delirium, hallucination, depression, irritability, difficulties with concentration, and schizophrenia. I bet you they won't tell you none of this stuff when you go see that guy in the white jacket with the snake and the caduceus. They'll just tell you, here, take some medication. Food and environmental sources of bromides. The most common source of bromides include citrus-flavored drinks. Brominated vegetable oil, BVO, is added to citrus drinks like Mountain Dew, Sundrop, Gatorade, and some energy drinks. Baked goods. Potassium bromate is made by passing bromine into a solution of potassium hydroxide. It is often found in baked goods such as bread, cakes, and cookies. In the 1960s, iodine was the dough conditioner of choice, but was replaced by potassium bromate in 1980. Despite the fact that the iodine it replaced was nowhere near dangerous levels. Man. Prescription medications. Atrovent inhaler, Atrovent nasal spray, that other word nasal spray, Propantine, pyridostigmine, bromide, Spiriva, Handy-Haler. Man, things can't be just named simple anymore. Flame retardant, polybrominated, diphenyl ether. Clothing, draperies, carpeting, upholstery, and mattresses. Man. Regular thyroid testing will not reveal bromide or bromine. Diagnosing thyroid disease triggered by environmental factors can be difficult, as many physicians use only the thyroid stimulating test, the TSH, to screen for hypothyroidism. This test often misses the disease because it does not directly measure the output of free T3 and T4 from your thyroid gland. In order to receive a complete and accurate thyroid function diagnosis, I recommend the Complete Thyroid Panel, Thyroid Antibodies from Direct Labs. This panel of tests will not only tell you whether you have hyperthyroidism or hypothyroidism, but Hashimoto's thyroiditis, or thyroiditis, something like that as well. Just take the test order slip to any lab corporation location to get your blood drawn, and LabCorp will send it away for you. You'll get your results in as little as 5 business days and can then discuss them with your doctor. How to eliminate bromine from your body. In order to prevent thyroid disease and other chronic health disorders, I strongly recommend tapering off of bromine. Read labels carefully to determine if bromines are used in products you usually consume. That's why they say you are what you eat. If it contains brominated vegetable oil, potassium bromate, or anything starting with brom, don't use it. I've been checking my labels out a lot more too, and I have a few labels I'm going to take pictures of and put them up on here. The best way to avoid bromines is to eat as naturally as possible. Organic vegetables, fruits, nuts, seeds, beans, legumes, meat, poultry, fish, coconut oil, and butter are some of the best foods available for your health. And there's no need to worry about so-called goitrogenic foods if you have thyroid disease. As a matter of fact, I recommend eating the goitrogenic foods some medical experts tell you to avoid because they're excellent for your health. I also recommend adding unrefined sea salt to your diet to offset iodine deficiency and clear bromines from your system as your body detoxifies. Good food sources of iodine include organic cranberries, yogurt, navy beans, and strawberries. You can also speed up the bromide detoxification process by drinking plenty of pure water each day and exercising regularly. Diamond Nutritional's Thyroid Support Formula nourishes your thyroid gland to help it function at its best. If my patients require thyroid medication for hypothyroidism, I recommend only natural thyroid replacement such as Armour Thyroid, Nature Throid, Urfa, or compounded thyroid. Synthroid, levothyroxine, contains only part of what your body needs. T4. The natural products contain both T4 and T3. Your thyroid gland makes both, and it is important to have them both in balance, which the natural products are able to provide. The ingredients in our support formula include iodine. Iodine is essential to the proper function of the thyroid gland. L-tyrosine, USP, provides hormonal support, increases mood, and improves concentration. Ashwagandha leaf decreases inflammation, boosts immune system health, and supports thyroid function. Bladder wrack leaf stimulates underactive thyroid glands. So bromines can do serious harm to your health. Take care to avoid foods and environmental products containing them while detoxifying your system with natural sea salt. If you have any questions about your thyroid or another chronic health condition, please contact your doctor, or this guy will help you. And you could contact this guy, I think, Dr. Craig A. Maxwell, and you could read about him more. He's the author of this whole page, I guess. You could pause it here, so you guys could pause this and read it if you would like. And questions, So I guess that's it for this part.